spoke about how to understand the nature of the child. Dr. Paresh spoke about immunity, and Dr. Divya spoke about acute illness. I am going to share with you what we understand by chronic illness. The chronic illness, as the name suggests, are those which are repetitive, which are prolonged, which are severe, which has lot of pathological illness, and which has severe pathology. For example, in small children, eczema, psoriasis, rheumatic fever which is coming again and again, rheumatic arthritis, attention deficit syndrome, autism, development disorder, chronic tonsils which is happening and child is suffering again and again, the tendency for various disease, especially bronchial asthma, etc., etc. Endless disease. For example, in case of bronchial asthma, modern doctors will give bronchodilators or steroid. 15 days child will be better, again it will come. They don't have a prolonged treatment or a right answer to the chronic problem. But in homeopathy, though we take time, but it is the only system or only science which has answer to this above mentioned problem. For example, as my previous colleagues mentioned, in homeopathy we aim at the patient. For example, if a child is suffering from any disease, eczema or asthma, we always see the pattern, the nature, how child sits, how child talks, how child narrates the complaint, his pace, his behavior, his dreams, his fear, and we just form a symptom totality. And whatever medicine we give, not only the disease goes, as a person also he improves. What I understand by this, I will illustrate with few examples. One case of attention deficit syndrome child, 3 years child, hyperactivity, lot of hyperactivity, electroencephalogram showed mild abnormality, consulted me in 90, the glimpses of the child. Sound.
और एक कुर्सी दे दे।
मैं जात नहीं है।
ठीक है।
मराठी मीडियम तो मुझे टाइम ही नहीं मिलता। मैं सवेरे 8:45 बजे निकली तो 5 बजे आती हूँ घर पे। तो जो दिन भर संभालने वाले, अभी कितना 7वीं 8वीं औरत होगी इसको संभालने वाली, तो बोले एकदम मूडी है, मूडी। कुछ भी खाएगा तो अपना टिफिन में अच्छा है तो खाएगा, ऐसा नहीं है। किसी का भी टिफिन ढूंढ के देखेगा अच्छा है तो उनका खाएगा, ऐसा करते। पूरे क्लास में ढूंढेगा, टिफिन में देखेगा और बिंदास उसका लेके खाएगा। अपना टिफिन का उसको ऐसा कुछ नहीं कि ये लेने का, इसको देने का, इसका कैसा खाने का, वैसा कुछ नहीं।
God bless you. See you.
See you, man. See you.
See you. See you.
Bye bye. Bye
See you. मैं
इसको भी लेके
हाँ।
आपको लाइक आपको
मैं नहीं है, वो दोनों नहीं है। तू बस मी जाते हैं अभी।
चाहिए आपको?
पूरे भी चाहिए, ये बैठेंगे तो भी नहीं चलेगा। अभी मैं जाएगी ना और ये बैठेगी, तू बस इधर, तो भी नहीं चलेगा। पूरे फैमिली चाहिए उसको साथ। चल चल
जा तुम्ही।
So we could see hardly he could utter a single word, no proper toilet training. He was very, very restless, which is very common in all cases of ADHD. Along with that, as you already heard, he could search the best tiffin of his colleagues and he could eat that. There is a lot of cleverness in him. And he was pushing others, very angry, he was dominating. So in this child, we observed there is a lot of animal energy. One particular remedy we gave, and this is the observation during the treatment. Please.
जुलाई में ट्रीटमेंट स्टार्ट किया था लास्ट।
जो स्टेबल नहीं था, पूरा ऐसा इधर उधर घूमता ही था और कोई भी इंस्ट्रक्शन वो सुनता ही नहीं था। तो अभी वो सुनता है, रुकता है कि क्या बोलते समझ लेता है और उस तरीके से करता है कि अथर्व इथे बस, कि वो देखता है मुझे बुलाया है, नहीं तो उसको बुलाएगी तो भी वो देखता ही नहीं था। लोगों को लगता था वो सुनता ही नहीं है,
हाँ हाँ।
कि उसको अथर्व करके बुलाएगी तो भी वो पीछे मुड़ के नहीं देखता था।
और बात करने का
अभी वो बात करता है, पहले थोड़ा थोड़ा बोलता था, अभी वो 2 वर्ड 3 वर्ड ऐसा इकट्ठा बोलता है कि मीनिंगफुल बोलता है। पहले मीनिंगलेस बोलता था, जो कुछ बोलता था वो बोलता था, उसकी भाषा ही समझ में नहीं आता। उसको क्या चाहिए वो ऐसा उंगली दिखाएगा तो ही समझता था। जैसे पानी चाहिए तो पानी का मटका है, उसके तरफ पानी कि बोलता ही नहीं था, तो ऐसा अभी वो बोलता है पानी दे, नहीं तो खुद जाके फ्रिज में से लेता है। नहीं तो मार्ट का चाहिए पानी तो स्टूल लेके जाएगा और लेगा। इतना ये इम्प्रूवमेंट बहुत हुआ है।
And this is a recent follow up. He can speak very well, he can understand
बहुत फर्क है इसमें। जैसे 3-4 साल बाद लोग मिले हैं ना मुझे, अभी इतने दूर से तो लोग आते नहीं है, तो अभी पूजा में आए थे सब लोग। ये देखो ये बराबर उसको समझता है किधर की है, तो बोले बहुत फर्क है इसमें। ये आता ना नको
स्टेथोस्कोप है।
और ये भी दिखा।
थाम जरा 2 मिनट।
कौन सा दिखाओ? कौन सा दिखाओ आपको?
ये दिखा।
ये
दिखाओ,
क्या करने का?
ये
दिखाओ म्हणायचं।
ये छाती में देखने का सर्दी खांसी है क्या ऐसा?
हाँ, मुझे सर्दी और खांसी है।
कुछ नहीं है रे, तू अच्छा है अभी दिखाता हूँ, लेकिन तू अच्छा है।
दिखा। दिखा।
दिखाता हूँ।
दिखाओ म्हणायचं।
ठीक है
दिखाओ।
दिखाता है, ठीक है वो मेरा दोस्त है, चलेगा दिखाओ, आई डोंट माइंड।
अब चलो। चलो बाय। ठीक है।
So there's the whole change. Not only his ADHD goes, as a person, as a child, he improves a lot, and he becomes like a normal child, very inquisitive, touching things, asking questions, etc., etc. One more case. This case of a 6-year-old child suffering from chronic bronchial asthma, and every 15-day mother had to give nebulizer, and very, very active attack where parents could not stand, and very, very sensitive to lot of food. I was just inquiring about the child. Child was describing one dream, and just observe how this child differs from the first child. About the dream first, let us see. Play.
पहिलं की मी एकटे जंगलमध्ये आहे आणि एक वाघ हळूहळू येतोय माझ्याजवळ खायला.
आणि काय झालं? You just ask her in the dream what was your
काय
feeling?
झालं मग, काय झालं पुढे?
नंतर मग त्यांनी मला खायला तो रेडी होता आणि मग मी अशी मागे 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 जात आणि मागे बघितलं तर एक वाघ होता.
ठीक?
तर मी परत त्या मध्ये त्यांच्या होती, तर मी असे 2 बंदूक घेतले आणि त्यांना यायला होते मागे 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 गेले.
मग पुढे ते वाघ कुठे गेले?
ते अगं सिंह आणि वाघ
मग ते गेले कुठे?
ते कुठेतरी त्यांना पाहिजे कुठेतरी धावले.
आम्ही तुला खाल्लं नाही ना त्याने?
So in my mind I was thinking, is it the dream or she is putting some masala? Especially at the end, the way she says, the tiger as well as lion, I took the gun, I was going behind, and her whole action. In my mind I am thinking, she can create stories. Then I explained her, she draws, I told her, explain me this drawing. In short, she says, they are all going to America, she is packing her bag, they live close to London. They stay near to Agra, they are searching their car, and that car, which is a new car, which has an aeroplane wing. So how much is her imagination? She has drawn, there is no aeroplane, but she is talking about Agra, talking about London, talking about aeroplane wings, and how she is creating. Then I told her to just tell a story. In a story, she starts with again Agra, big saucer, Rajabhai Tower, skeletons, big eyes, this type of hair, very scary, and the way she was producing and narrating the story, I could very clearly make out she has a beautiful imagination and she can manufacture her stories. And she had lot of fussiness about particular food. Some prawns has to be given, some special non-veg has to be given. She was very reserved and she was in her own thoughts all the time with very frequent history of illness. This is next please. So on one side there is theorizing, rapid quick thoughts, lot of dreams of animals, theme of danger, writing desire for. We understand the child as many desires, many ideas, fantasies and stimulus hunger. We gave one remedy from plant kingdom. Let us see what she says.
No, she is absolutely fine. She has changed her behavior a lot. She was very short-tempered, but now she has changed. And she was very particular about her eating habits, but now she has changed a lot. If I tell her that you have to eat only dal and rice, she eats that.
Before, what was the thing?
No, she was very particular. I want prawns today, I want this today. She was pure non-vegetarian, but now she has changed a lot. Now she eats some vegetables or salads, or only dal rice also she eats. If I tell her today I don't have time, say that you just have chapati and milk, she eats that.
And
Now she has become very much friendly with others. She was very reserved. She was not very friendly. That has also changed a lot. And about her health, her this cough and cold, that is also now last 2 months she doesn't have that much problem of that cough and cold. And asthma especially.
how is that?
That is also last 3 months I have not given her nebulization.
Not only that, it is a very rare case where since the first attack, no attack at all. She didn't require nebulization in last 6 hours. Only she had one mild attack, one SOS dose was given, and she did fantastically well. So with homeopathy, not only we treat the disease, as a whole person, the whole child changes, her nature, she is mixing with the friends, she is communicating well, she can eat normal healthy food also, and disease goes. One more case. This child came back from USA because of this atopic dermatitis, and so much steroid and antihistaminic were given, parents were frightened to stay at the States. They came and I referred the patient to Dr. R.K. Anandji also, and R.K. Anand was also surprised to see so much steroids and medicine and very less allopathic medicine doctor suggested. This is the picture before treatment. Next. And I gave a very inquisitive child, touching everything at the clinic, asking lot of questions, observing what I am giving at my clinic, a mineral kingdom, lot of inquisitiveness, one particular remedy we gave, and this is after the treatment.
Yeah, his skin is definitely much better, and his immunity has increased. He is very confident. So
What way you can say immunity is improved?
immunity is improved. It's like he doesn't fall sick much often. You know.
And skin, what are the changes, especially for this atopic dermatitis?
Changes are it's much smoother. Then I don't see the scaling anywhere. That is Sanjana.
Sanjana?
Yes.
Yes, Sanjana. According to you, what are the changes since he is taking my treatment?
Since the treatment, the homeopathy treatment, there has been a lot of changes. Earlier it was dry, it was red, there was lots of agitation, and from his behavior and his skin, everything is completely different. Now the skin is not only softer, it's nice to touch. I feel so good because I can see him behaving himself. He's not worried about his skin anymore, and it's no longer the way it was before with the harshness and the redness. So I'm really happy to see how far he has come along in such a short time.
And what was the main change in his behavior?
His behavior wise, although he has been more or less the same, I'm happy to see he's not as angry as he was with his skin, and he can face all that, as in all the problems that comes with eczema. He's able to face it now, and it's just better for the family that way. We're happy the way it has come.
Okay. Thank
So it is better for the whole family, and not only the child's problem goes, the whole child changes, the whole as a person, as a child there is a change. So definitely I should say for chronic disease, homeopathy is the choice or the first preference we can give, and it is the right answer for chronic disease where we remove the tendency for the disease.